Hopefully you people had a nice lunch. 42 million people living with type 1 diabetes in Pakistan, and simplifying the life of type 1 diabetes has always been a prime project for PES, SPED, MED and GITS, and they have launched the SMILE project for especially type 1 diabetes. I would not take further time. I would like to invite Sayyid Abbas Raza. He doesn't need any introduction. He is the past president of Pakistan Endocrine Society, current president of International Society of Endocrinology, and he would further take over the details of the project. Please, a big hand of applause for Sayyid Abbas Raza.
All right. Again, it's wonderful to be back on the stage. It's wonderful to be announcing something which has been a very near and dear to my heart, at least, when we started talking about type 1 diabetes and the management of type 1 diabetes and the scene of type 1 diabetes in Pakistan. So the project SMILE, which is simplifying the life of type 1 diabetes, started off with a pilot project, and I'll give you the description of what the pilot project was all about. And I'm so happy that today the time has come in which we are not getting the learnings from that pilot project, but now we are formalizing the project and moving ahead with the project. And I'll give you who are the partners and who are working with us in time to come. What is SMILE project? Again, the project objective is generally to improve the care of diabetes. So I'll give you anecdotally what is happening in the diabetes world, and especially in type 1 world, in the real life. So if you look at the global statistics of diabetes type 1, any country would have about 5 to 10, and in some countries it could be 3 to 10% of type 1 diabetes if you look at the total number of type 1 diabetes. The number of diabetics or people with diabetes in Pakistan is about 40 million, and about same number is undiagnosed. So you can live with type 2 diabetes being undiagnosed, but with type 1 diabetes, probably you could not live long enough. So if I just extrapolate the data from that, if 5% of the people among diabetes patients have diabetes, if we just do the simple math of it, we would expect about 1 million people minimum with type 1 diabetes in Pakistan. And guess what? If we look at any other registry, data set, information, or anything which comes out of Pakistan, how many diabetics type 1 people with diabetes type 1 are, the maximum number that I found was about 15 to 16,000. Where are those hundreds of thousands of people which are expected in our power? We don't know. So this was a humble start that we did. And most of these people who don't know if they have type 1 diabetes live in a lower socioeconomic, and that's where the origin of SMILE project came into being. History of diabetes, the SMILE project, this project was started actually not today, but many months back, when I have Dr. Umar, who was heading Umar Diabetes Foundation, Gets Pharma, who's part of our new project as well, and Med Consultant, where we thought that maybe we should start at least someplace. We took out and adopted kids with type 1 diabetes. We started treating them with free insulin. We started giving them glucometers. In an economically restrained country, if you look at the devices like Libre or the continuous glucose, it's almost impossible. But in this subgroup of people, we were able to give them even devices like Libre. So how the process we defined, and this is brief introduction for the reason that I think in future we will have to use. So you would have to be registered at Umar's hospital, Umar Foundation, and Umar is with us today. I'm thankful for his cooperation. You will get the basic blood test done. You'll get the basic information done. And then, I don't know if Dr. Sumaya is in this room as well. She was part of our project earlier when we decided to start treating these individuals under the care of a pediatric endocrinologist, which they probably have never seen in their life in the past. We came across people who had not only poorly controlled diabetes, these were the individuals who were using combination, fixed dose combinations, having lots of highs and lows and lots of high A1C, which ultimately resulted in poor outcome. We kind of transformed their life, and that's where the idea of starting this a global project. In our project, we included giving free insulins, free labs, CGMs, glucometer, and not only that, education by a diabetes educator. Jazib is sitting with us. He was heading this project. We gave free education to all the people with type 1 diabetes and their family members, and whoever was interested in that. And in this, we were capacity building also the Umar Foundation, which has diabetologists and a diabetes educator, but educators did not have enough material, and we kind of upgraded their facilities as well. So what is the SMILE project? We luckily have 4 partners in which Pakistan Endocrine Society, and I thank Aisha for being part of it and again agreeing to being part of it. The Pediatric Endocrine Society, in which Dr. Jamal Raza and Dr. Jeda is here. Med Consultant, which I was started between Med and GETS, where the project was started. These are the 2 organizations who are part and parcel of this project as well. What are the key stakeholders? I would like to welcome Khurram from GETS Pharma, and obviously Dr. Jamal, Dr. Aisha, and myself for being part of this project. I would like to hear a word from them when a time gives, but let me give you what the SMILE actually framework is. So we are planning in this planning phase, and I want to share it with the rest of the group so that everyone is on the same page. We are planning to develop a steering committee which all the stakeholders, and Iram Ghafoor, who is I think here in the audience as well. Yes, there she is. Unfortunately, our collaboration was too close to this meeting, so we couldn't get her on board as far as signing the MOU is concerned. We will be working her. She probably runs the biggest network of diabetes educator in Pakistan. Not only in Pakistan, I think is globally is one of the biggest diabetes education providing platform for it. So now we have pediatric endocrinologists, we have adult endocrinologist organization, we have diabetes education support with us, and then we have an industry support to help us in the project. There are multiple prongs with it. There is a nutrition program, there is a peer support program, there is a research and advocacy. So it encompasses everything. How are we going to run it? We divided that into separate. So there is an adult nutrition program, and our first project is to launch definitely. This was something very near and dear to Dr. Ibrar and Aisha. They wanted to bring this. We are going to bring this in this population. This is for adults only. The pediatric component will be done by Dr. Jamal Raza, in which they are going to develop guidelines and help us in developing carbohydrates counting in Pakistani food, which is already there, but we are going to formalize it as the time goes on. Secondly, treatment access. Obviously, there will be an adult arm, which will be, and this is in principle that we've decided that there will be 2 arms categorically different than these. There will be an adult arm, which will be dealt by the adult endocrinologist, and pediatric arm, which will be dealt by the pediatric endocrinologist. We plan to open up clinics as our basis for treating type 1 diabetes. Then there is a big need for peer support group. All of us are working in silos. We have smaller groups who are working in silos. We want to join everyone together and probably get our community going together. At this time, I would like to invite all the stakeholders on the stage so that we can at least have a quick word. Aisha, please join us on the stage. Dr. Aisha from Pakistan Endocrine Society. Khurram, I'm just going from one direction to the other. Khurram from GETS Pharma. Dr. Jamal Raza from Pediatric Endocrine Society as well. And then I would like to say that this is not the last of how we would want to. We would want to bring up the education part into it. We would like to bring up the research part of it, and this is all part of project. So it's just a humble beginning towards starting something new, something for the betterment of type 1, and one of the most neglected area of diabetes in our part of the world, which is type 1. We would like to invite anyone and everyone who is in this audience to become part of it if they are interested in treating type 1 diabetes. Unfortunately, the territories of type 1 and type 2 were so vaguely defined that it was difficult for us to even interact. So this is, I think, one of the major initiatives in which we'll be working with the pediatric endocrinologists and everyone together. We plan to not only look at the education part of it, we plan to open up smile clinics across Pakistan in which we'll be treating type 1 diabetes at different stages and getting the peer group ready for us as the time being. I would like to go around and ask a quick question about a quick comment on how, obviously this is a combined effort, and I would like to hear what are the impressions of the people who are part of it as a quick word, and how would they see this project in years to come. Starting with Aisha, could you say?
Thinking about this project and working on this, this is something which we have been planning for last few years. When our teams went to UK to observe DAPHNE, which is a structured diabetes education program for people with type 1 diabetes. And since then, the DAPHNE core team and many of the members are already here. Professor Najmul Islam, Dr. Umar, Sabah, they are all part of that core team. We have done a lot of work on bringing DAPHNE to Pakistan, but still when it came to funding, despite applying for funding with the World Diabetes Foundation and some other funders, we were not able to acquire that funding and could not pursue that till now. So if you recall Ahmed Iqbal's talk in the morning, where we were discussing hypoglycemia and type 1 diabetes, and when they were talking about the solutions to that, the hypoglycemia and type 1 diabetes, if we look at fancy solutions like smart insulin, which are still in the pipeline, and then diabetes technologies, that will be really costly options for us in Pakistan. But the data has shown that an intervention as simple as a structured diabetes education, and we have lots of data, already published data on DAPHNE from different parts of the world. Different countries have adopted DAPHNE for their patients with type 1 diabetes, which will eventually empower these patients to self-manage their disease in a way that they can avoid both hyperglycemia leading to complications and hypoglycemia leading to, again, different kind of complications, empowering them to have a good quality of life as well. So through SMILE, I can see that this is something where adults with type 1 diabetes will benefit from that structured diabetes education and can understand their diabetes better, because right now the situation is that many people with type 1 diabetes are only aiming for prevention of diabetic ketoacidosis rather than prevention of long-term complications that are that occur very often in our patients with type 1 diabetes. So and all the arms and your plan implementation plan is already there, and I would really be looking forward to how this would eventually evolve into a real practice across Pakistan. And I'm really happy that you have brought in all the stakeholders. Professor Jamal Raza, thank you very much for being part of this project, and then the Diabetes Educator of Pakistan. Together, I'm sure, and with the help and support of Guest Pharma, I'm sure that over years to come, we will be able to improve care of our population, people with type 1 diabetes. Thank you very much.
Thank you very much. Dr. Jamal Raza, if you want to make a quick comment.
Thank you, Abbas. Thank you for giving me the opportunity, and thank you for this project. I'll start with a शेर of Ustad Zauq कि बीमारे इश्क का न हो तुझसे हो गर इलाज, बीमारे इश्क का न हो तुझसे हो गर इलाज, फिर तू ही कह कि तबीब कि फिर तेरा क्या इलाज. So I guess we are all partly guilty of not managing the situation adequately. I've been back after my training in UK for the last 30 years, and I'm struggling still with the optimal management of type 1 diabetes. We have had data collection and all that, and even, I was comparing data where we look at the child presenting with DKA as the first diagnosis. And over the period of last 20 years, the situation has unfortunately not changed. So we were still getting about 50% or more children presenting with DKA as the first diagnosis, and 20 years later we are still getting about the similar number. I'm talking about public sector hospital. The situation is different in the private sector, and the realization is much better. So that's as far as the presentation goes in children, because people are still not accepting the diagnosis of polyuria, polydipsia, and relating it to type 1 diabetes. After the diagnosis is made, there's a lot more in terms of the treatment, and we are again still struggling initially because of this very small number of pediatric endocrinologists that were present across the country. Dr. Chaida is still, I don't know if she's here, but very few of them really well trained for the type 1 management of diabetes. But even the pediatrician should be able to manage the type 1 diabetes. But a uniform management protocols are existing, but probably not being followed across the board for all the type 1 children. So, and then the third thing was the transition, because when we see children, there is really very little mechanism that exists when children are being, commissioned into adult and then go to a care to seek care from the adult endocrinologist. And that is across the board. Now, it's not just for diabetes, but across the board for all the endocrine problems that need some kind of a transition to exist. So I see this SMILE project, first of all, a very important project for establishing a collaboration between the two, not just organization, but group of physicians who are treating adults and children, to be able to hopefully standardize the management of diabetes, type 1 diabetes, again across the board between pediatric and adult physicians, to be able to generate research and, as you said, probably identify a lot more patients that are presently and currently identified in terms of their numbers, and we are probably underreporting a lot of diabetes in our own country. And then finally to develop some kind of a cohesive treatment and some kind of a transition mechanism, which will probably later on go on to the other diseases where a pediatrician or pediatric endocrinologist treating an endocrine problem will be finally able to smoothly transfer that care to an adult endocrinologist, and the adult would be very happy to smoothly take over from a pediatric care. So I think there are many important milestones that are hidden within this project, and most importantly, hopefully we are able to provide the best of the best care for our pediatric, for our type 1 patient. I say pediatric because I'm a pediatric endocrinologist, but I guess for all type 1 patients. Thank you very much.
So Dr. Jamal, you brought in a very important point in transition from pediatric care to adult care, and from adult care back to pediatric care. I will come to you for final conclusion, Khurram, but before I do that, and I have a question for Peter Schwartz, who's the current president of IDF, which is probably the world's biggest diabetes federation organization right now. Do you have any, you haven't gone through this project, now you must have seen it across the different continents, these projects being launched, and again, do you have any comments on how you see this project in this part of the world? And number two, how do you see this project evolving over years?
First, about the numbers you have mentioned. If you are thinking about the 7% of people with type 1 diabetes here in Pakistan, actually known cases is so small. There are many people with type 1 diabetes not diagnosed. There are many people who are diagnosed, children who die because of type 1 diabetes. And as long as a person with type 1 diabetes is not diagnosed or is dying because of the diagnosis, we have not fulfilled our task as people getting engaged to improve quality of diabetes care. You mentioned the International Diabetes Federation. It's not probably the largest organization. It is the largest organization. It's an umbrella organization of 242 diabetes organizations in the world. It's the largest NGO in the world. There's no other, at the United Nations level, other organization being bigger than this. And all these 242 member organizations cover diabetes care in all countries in the world, because there are many pan-national organizations involved. And so it's actually the right hub to think about what we can do to act on different levels. First is to enable that someone who is having type 1 diabetes is diagnosed, because this is the first step. I had a meeting with a young girl in India, and she was introduced to me. She was 14 years of age, and she told me she was 11 as she was diagnosed with type 1 diabetes. Her mother gave her a can of petrol to burn herself because the family cannot pay for the insulin. I met a father of a type 1 boy in Congo, and he told me he's earning money per day. So every day he has to decide buying the insulin for the child or the food for the family. And these are the examples. As long as they exist, we have not fulfilled our task. And now there are organizations and projects like SMILE. There are initiatives from ISPAT. There are initiatives from Breakthrough Type 1. And they all focus on we have to be better in diagnosing the children. So, and I'm very optimistic that this will work. But what is the next step? We have to talk about availability and accessibility of insulin. Diagnosing them and then not providing treatment will be a failure. So that means this will be the next step. It's a dream what you are doing here with this project, but rolling out this to 3, 4, 5 million people with type 1 will be a big challenge, also economic challenge. So we have to think about, can we develop sensors maybe for less than $1 or less than 50 cents? I'm very sure that in 5 years from now, we have glucose sensors for 2 weeks or up to 4 weeks, less than $1 for the month or for the 2 weeks diagnosis. So this will disruptively change our ability to target therapy. But then we need the second approach. We need to have available insulin. There are big companies in the world who give very cheap insulin, less than 0.5% of the price they pay in Europe, to the region here. But what is really needed, not relying on, I apologize for the big ones, but not relying on the big ones, we have to support local companies producing the medication here in the country and being the partner for the patients here in the country. And then the third point is, it should not be an economic challenge for a family to have type 1 diabetes. And in most of the countries, it is like this. Only 13% of the people with type 1 diabetes are covered by Ministry of Health or health insurance. 87% in the world are not. So if it's an economic challenge for the family having someone with type 1 diabetes, think about this 14 years old girl, then we have not fulfilled our task. So the first step is important, but you have to think about the second step, the third step, and the fourth step. And the only way to do this is joining the forces, the ideas, the passion and enthusiasm of organization like ICE, like IDF, like many other organizations in the diabetes sector in the world. And I would like actually thank you to be here in the room, to listen to this project, to see what is done, and to think about how you can make in your daily work a difference for the still undiagnosed people with type 1 diabetes here in Pakistan. For this, a big thank you very much.
Thank you. And I think if I put these words into perspective for Pakistan as well, it's Peter, you'll be surprised that unfortunately the collaborative effect approach is not there. We all do works in silo. I know of pediatric type 1 diabetes treatment groups and organizations who are doing wonderful work, but they don't have a pediatric endocrinologist on board. I know of a lot of adult type 1 diabetes work which are doing wonderful work, but they don't have an adult endocrinologist. So I think that also, because at the end of the day, you not only need to reach out, but you need to reach out with the right advice, right time at the time. And you talked about insulin again. we are lucky in many sense that our local industry is picking up, and again, because of the global crunch in insulins and especially the human insulin, the local companies are picking up and they're making. And one of the major contributors in this time in Pakistan is the pharma industry is Getz Pharma, who is also part of this project. And we have the CEO of the Getz Pharma, and I would love to hear about why Smile, and again, how would you think as a contributor in this project as an MOU? Over to you, Khurram.
Thank you. Being the only Pakistani-based pharmaceutical company, and I should say a biopharmaceutical company, this was something which is very close to our heart. And the reason why is because we were at the helm of affairs when the insulin shortages started happening across Pakistan, and then some of the LMICs where we are today. I'm talking about Sub-Saharan Africa, I'm talking about Southeast Asia. And we were reached out by a significant number of health regulators and policymakers about the availability of insulins. Thank God we were at a point where we had the capacities, and I can very confidently say that we have the capacity to provide biosimilar insulin in more than 35 countries, which are mostly LMICs where we are today. So, Dr. Abbas, this is a project which is very close to our heart from value perspective, because the values that we believe in, and Ms. Iram is here. We recently also signed another project on non-communicable disease with them in terms of extending the access of healthcare and standardizing. And we've been working with you on standardization of healthcare as well. So I believe NCDs, with the population bulge that our country is going through, and with most of the LMICs that are going through this population bulge, we are bound to have NCDs as a major health concern, and within those, diabetes would obviously top the charts, and therefore making sure that we not only have therapies to address, but things such as CGMs, which are moving fast. We have plans to bring that very soon as well, and the likes. So absolutely there with the HCPs, absolutely there with you, and everybody who's part of this project. I congratulate you for starting this.
Thank you. Thank you very much. And we'll do the quick signing of the MOU. And again, if we can have the papers ready, I think it's already on.
Before we do the signing, I was just reading this morning a book, and it very interestingly came up a Chinese proverb which says, use your smile to change the world. Don't let the world change your smile. So I think that would be very apt for the project.
Aisha. So we are in the mood of Smile and the Smile project. We are even wearing the coats which reflect the colors of Smile as well. So we were better prepared. Please follow me. Now we'll have to. Thank you. Sure. Peter, can you join us again? I have the honors of taking a picture. We can sit in. Thank you. Thank you very much, everyone, and we'll proceed with the rest of the event.